Welcome, people. We're just letting everyone in, so bear with us for a minute or two. Let's give it one more minute, people. We've still got people joining. Right, let's make a start. Thank you, everyone, for joining. I know it's that tricky time of year when you start having to juggle holidays and children and schools being off if you have children. And so we really appreciate you making time for this today. My name's Paul Harvey. I'm going to be chairing this webinar today. Just a couple of bits of housekeeping. It is being recorded. And will be sort of put up for people who've registered but haven't been able to attend the live version. The recording will be posted. There's a Q&A function or a chat function. Put questions in the Q&A, put chat in the chat. And if you really want to say something, you can't at the moment, but put your hand up or ask in the chat. And as hosts, we can allow you to speak. So if people want to say something rather than write it down, let us know. So this webinar is about frontline social workers in protracted crisis. We're going to be sharing experiences and evidence from aid practitioners and researchers working across the humanitarian development peacebuilding nexus in different crisis settings. And our focus is on frontline workers in social protection. By social protection, we're talking about the policies and programs that aim to prevent or reduce poverty, vulnerability, and social exclusion through a person's life with particular focus on vulnerable groups. We convene this roundtable and webinar because we think that frontline workers in social protection are key to effective interventions in crisis situations, but that the workforce is often neglected, that important local capacities and skills tend to be neglected and sidelined. And there's often a focus on sort of technical systems and processes, on building databases or creating social registries or payment systems, without enough attention to the workers who operate the systems and who are the critical interlocutors between communities and people receiving assistance. So we've asked the discussants who we've got today to share research and perspectives and practical experience from places such as Yemen, Syria and Iraq and beyond. We're looking forward in this webinar to drawing out some of the barriers and constraints that make it difficult to better support social protection workers, but also opportunities for external aid actors and others to better support these critical local capacities with the end goal of more effective and more inclusive assistance. On that note, I will introduce the discussants. So Vincent Van Helsema works for the World Food Programme headquarters as Global Advisor for Social Protection in fragile and conflict-affected settings. But his career in social protection over the past 15 years has also included work for UNICEF in Angola, Ghana and Mexico, for the ILO in Zambia, Malawi and Mozambique, and coordinating the Transform Social Protection Capacity Building and Leadership Initiative across Africa. Welcome, Vincent. Abir Al-Labsi is a Yemeni researcher and consultant with 23 years of experience in the development and humanitarian fields. She currently works with us in basic research, and the STAR facility has contributed to the interagency humanitarian evaluation and reviews for FCDO, their approach to localization. Her work focuses on gender, social protection, localization, the nexus, livelihoods and resilience. And Sarah Blinn is an expert in social policy, also about 25 years of experience across many countries. Her work focuses on the intersections of social protection, care systems, gender equality and disability, will focus on policy design, research, and strategic support to governments and UN agencies. So as the director of Parted Consulting, helps in leadership roles with NGOs. Becky is just putting a thing in the chat because she's realised that I haven't got her details on the intro. She's with IDS and is working with me on basic research, better assistance in crisis, which is an FCDO-funded IDS-led research program, which research of which we'll be drawing on as we talk. We promise you Rachel Slater, who isn't able to join us, so I'm going to be doing a bad job of presenting her slides and talking about the work that she's been doing with Proximity International, looking at these issues in the context of Syria and Iraq. And she sends apologies, but it's poorly. And on that note, I will hand over to, I'm realizing I hadn't noted down the running order, Vincent, I think, with apologies for being confused. Vincent, over to you.
Okay, thank you. I've shared my screen. You should be able to see it. A happy nod or something from Paul. Or, yes.
We can see it. You need to go to slideshow view.
Okay, 1 second. Now?
Yep, all good.
Perfect. Thank you. Okay, so thank you very much to all the participants for joining in this really important discussion. I'm just going to share some concepts from a paper that we've been working on together. What started at UNICEF and finished last year, where we looked at 10 countries in Africa to understand what exactly this frontline social workforce is. So there's not that much research that's been done on it, and I'll just tell you a bit about why this topic came up. So as Paul indicated, a lot of us have been working across many countries, particularly in Africa. And despite all the growth in social protection programs, then becoming more mature, advanced, interconnected, digital, etc., we realized that there was a critical gap. And that gap was the actual humans that are needed to make the programs work at the community level. On top of that, a lot of these countries, a lot of the world is facing increasing shocks and crises, not just from conflict, but including conflict as well. So these systems, which are already finding these sort of limited capacities at the frontline level, are then being put further to the test when these shocks are taking place. And we realized there was, in our work, a very heavy dependence on effectively a non-professional or volunteer workforce, as well as social workers themselves. So we did this paper, we looked at 10 different countries, and we realized a few things. One is that there's very little research on this. The topic features very sparsely on donor and even national development strategies. So who are these frontline workforces? What exactly is their role? This is what we set out to do. As part of this, and you can read the full paper in the link that I think Becky has shared, as well as a link to a very interesting webinar we did on it with experts. We came up with a bit of a definition. We tried to get some language around how to look at the topic. So social workers are often critical, but just in those 10 countries, we found 57 workforces working in non-contributory social protection across 2 administrative tiers. I'll come back to that in a moment. So just to give you the definition that we adapted from the Global Social Service Workforce Alliance, for social protection frontline workforces, all salaried and unsalaried, government and non-government workers that directly interface with potential and/or existing social assistance recipients and their communities to perform key functions of social protection delivery, whether routinely or occasionally. I know it's a mouthful, but that is because it is actually a really complex tapestry often that takes place at the community and sort of the lower administrative levels of different people from different sectors or even just volunteers working together. The functions that they perform are familiar to anyone working in social protection or even humanitarian assistance, which includes the provision of information, identifying, referring people, registering them, delivery of assistance or supporting the delivery, and also case management and linkages to other services. Besides that, of course, also assessment of need, monitoring and reporting the data that helps governments and large organizations to program their assistance. So we confirmed in the course of our research, which took several years because it was done sort of on a volunteer basis, that that a lot of the concerns we started out with actually do bear out in practice. That frontline workforces are weakly defined, they're weakly structured, they have limited resources, they are often very, not trained or give very little training, remuneration, or support. So just to give you a little bit more of that language. So I talked about tiers. We looked at the tier one being the sub-district level, right? Really the community. Different countries have different words for that or different administrative titles for that. And then tier two being more the district or the municipal level, where you often still have a social welfare department. So you'd have actual trained social workers. And they would be important entry points for the sector for social protection, but they'd obviously also be in charge of doing their own jobs, which is social work or agriculture extension or healthcare provision, depending on the sector that they're falling on. So you start seeing that a lot of people that are there anyway are then being relied on to do the sort of the key overseeing and operating of social protection in their district, but they then rely on a network that they have anyway of community level collaborators and volunteers. So, examples of these 57 workforces are, just across the tier one. So this is really the community level. And we came up with 5 categories of workers. And I have a more detailed graph, which I'm probably not going to show you. But that also shows how they sort of intersect. But we found effectively 5 categories of workforces. First being collaborators. These could be, community leaders, chiefs, assistant chiefs, traditional leaders. They could even be, church leaders, religious, etc. And they are important because they are effectively gatekeepers. They can also make sure that there's a sense of fairness of the assistance being delivered. Then we found effectively 2 categories of volunteers, individual and community level. So a lot of programs have, Ghana, for example, has community focal persons and health volunteers, different sectors, but effectively contributing to the implementation of the Livelihood Empowerment Against Poverty program, LEAP. Mozambique has Permanentes. Several other countries also have volunteers. They're not really paid or remunerated. I'll give you a few examples in a moment. Then we found an overwhelming amount of committees, right? So, and they're often not paid at all, or some might be given a stipend, such as in Ethiopia with the Kabele Appeals and Food Security Task Forces. But these are effectively groups of community leaders, of volunteers that come together and help with some of the key functions that I mentioned earlier, right? And between the two of them, the individuals and especially the committees, a large part of the social protection delivery at the local level is taking place all across sub-Saharan Africa, and not just right, also in the Asia Pacific and the Latin American Caribbean region. Then there is the group of paraprofessionals. So these are people that are being partially paid or partially trained. They might have an ongoing salary. It might not be up to the standards of a professional. Their contract might not be as secure. They might fall under the agriculture sector or the community development sector or the health sector. And you see quite a few of them that are sort of in between being a volunteer and at the community level, getting some support, some resources, but then obviously not fully social workers or health workers in terms of their training or remuneration. And then you effectively come to what many of us know, which is, some of the statutory roles like the development agents in Ethiopia, community health workers, but also really the social workers in many of these countries, right? The people that work in the social welfare department and do case management. So you see that there's a huge amount of people that are effectively unrecognized and unregistered, even before you get to the critical role of social workers and some of the statutory roles. Then you see and this is important also, the administrator category, which is in the case of South Africa, it's very professionalized. So you have less social workers and volunteers, etc. You have far more grant administrators. So in South Africa, they do have roles, they do have resources, and they do have kind of a career trajectory. But with administrators, we also mean people that are, for example, the director of the social welfare department of the municipality social department that is then overseeing the budget or the allocation of resources or is making decisions. So those people often also play a direct role in supporting the delivery of social protection functions, but more in an oversight or back office capacity. So across these five, you're able to effectively categorize most of the workforces. There's some examples here. I won't dwell on them because we don't really have time, but do look at sort of the broader paper. But just to give for just to emphasize some other elements of this problem, you have the topic of workforce size, and then, so how many of this particular workforce there are, and then in relation to, of course, other workforces, but also the clients themselves. So if you, for example, look at Ghana, you have 10,000 community focal persons. So that's one for every 250 clients, right? The Ghana Lead program has 2.5 million clients, and they get $15 per pay period. So every 2 months, they get $15 to do the critical work of supporting, in their community, 250 people. There's no back alternative if they're sick. They don't have training. They don't have like resources to get to one place or another, or even phone call people. They do get some stipends sometimes for calling. But you can see that, if you're trying to do this at a national scale and then let alone have a crisis come like, a drought or a flood or whatever it is, and that further stretches the capacity, you can see how difficult it is. One in 250 is actually not uncommon, right? Often they're looking at client ratios of 1 to 100. In the case of Adecco's, they cover 1,650 kind of people individually, right? So there's really it's very hard to have any type of professionalized engagement. In the case of Zambia, you have 80,000 community welfare assistance committee members, right? So it's a bit more, but they get very little. They get $2.50 per pay period, right? So that also really starts questioning the motivation. One important thing with South Africa is that despite there being 18,700 permanent posts for social assistance administrators, only 6,200 of those are actually filled, right? So here you're seeing a lot of the problems pop out when it comes to the professionals, the specialists, the social welfare officers. Look at Ghana again. You have about 260 district social welfare officers for the whole country, right? So each social welfare officer has effectively 1,000 clients when it comes to LEAP. And when it comes to social welfare itself, the norm is usually 12 to 15 people as being a heavy caseload. They're often doing this on top of their caseload, right? And often they're not being remunerated for their caseload. The only thing I want you to take away from this is the higher up you go in tiers, so the administrative tiers, we found that the more specialization occurs, right? So if you're a social worker, you're often part of the social welfare department. At tier two, you very clearly have your own work. You interact with the health department, the education department, etc. But the more you go down the community level, it's spread out, right? One volunteer for the social work department, for the LEAP program, for example, will also be volunteering for other NGO programs, for education programs, for health programs, etc. So they'll often be wearing multiple hats, and that also stretches further thin, like the degree to which they can complement. So I hope I have time. I think I do have time for the final takeaways. So just kind of three things I want you to take away from from the study that's relevant for this discussion. There simply aren't enough frontline workers, right? You already saw the massive differences in how they're structured, but also like the client worker ratio is sometimes nothing short of insane. Um, so there's also, there's a lot of talk about digitalization that can be a double-edged sword. On the one hand, okay, that can help people do their work. On the other hand, digital is often not an option, or you have to train people to do it, or they might have to do it in lieu of other things that they would have been doing so you have social workers that now become enumerators because the country needs a social registry, for example. And then they're no longer doing social work because of that, right? There's just not enough people, and often it's built on informal foundations. So this whole structure of what is usually delivering mutual support to people is often the same structure that's then delivering the formal support. They're just being sort of tapped into based on, the goodness of their heart, or sort of their roles as community volunteers, or especially committees anyway. And they're saying, well, here's a formal program that we're layering on top of informal mutual aid structures. And that begs the question of, are we not only, building an unsustainable formal program, but are we also potentially undermining the informal mutual aid structures? And often, as I pointed out in the beginning, they're not really ready for shocks, right? So in crises, they can get overwhelmed. And often, especially if you're looking at things like violence and conflict, you have people that are effectively also affected by these shocks, by these conflicts and fragility, and they are then being asked to deliver aid, but they themselves might have need for psychosocial support, aid themselves, right? We saw in Ethiopia with WFP when we're implementing the assistance in Tigray, that effectively a lot of the frontline staff was still working despite not having been paid for months, sometimes years, just because they believed it was important. But, are they being supported? That's a question with the degree they need. I don't have time for a full wrap up, but I will say that it was good to have the study to get some shared language, which I've shared here with you, that can help us to have more common ways of talking about this topic, about this problem. The pressure I've mentioned, that they're often affected themselves, that the workforce is often informal, and that we shouldn't just collaborate with we should collaborate with these systems, these mutual aid and traditional systems, not just rely on them. That means also supporting them, make sure they're not undermined. And then there's really two reflections that I think are helpful for the rest of this discussion, which is in countries with established social protection programs, we need to better structure these workforces. They need to be national strategies, national budgets. Some organizations like UNICEF are increasingly doing that anyway, right? They're putting that in sort of their child protection and social work, and making sure that links with the social protection work. But many governments do not have even a volunteer strategy, despite relying on tens of thousands, sometimes hundreds of thousands of volunteers to deliver their social programming, right? So these are the kind of things that need to be addressed. But then and then of course then they need fair remuneration, training, etc. But then in protracted crises and fragile settings, we really have to start thinking far earlier about the workforce planning, and not just wait until the system's emerged or the crisis has abated, but really from the beginning start thinking about who is the workforce that's sustainably going to leave when programs, pilots, etc., are finalized, that are going to be left behind to then ensure sustainable programming. That's it from me. Thank you, everyone.
Thank you. Do read the paper. It's great. Huge thanks, Vincent, for interrupting your holiday and joining us from Virginia, USA, which is where Vincent is. I'm now going to hand over to Abir, who we're absolutely delighted can join us from Yemen. There's always a risk in joining us from Yemen about connectivity. So if there are any problems, me or Becky will leap in and help. But fingers crossed, over to Abir.
Thank you, Paul. And that's a part of the suffer that we are facing in crisis sitting countries. So I hope the internet connection will be stable to the end. Thank you, participants, for being with us today to discuss this important topic. I'll share findings from our basic research study investing in frontline capacities for social protection in deepening crises, with lessons from Aden and Hadramaut in Yemen. I co-authored this study along with my colleagues Becky Carter and Paul Hervey, and I invite you to listen with two questions in mind. Who keeps social protection running when crises drags on, and what would it take to sustain and elevate them? So the project is part of the basic research program, Better Assisted in Crises. Our aim is to understand the everyday realities of frontline social protection workers and how international actors can support their capacity without undermining it. We carried out in-depth qualitative interviews between December 2024 and February 2025 with both frontline staff and managers working in government, parastatal, delivering cash transfer in partnership with UNICEF and the World Bank, and Yemeni NGO running social assistance programs. And also we conducted 20 live history interviews, which gave us rich, grounded insight into what's working and what's not. And that was a good opportunity that we also present the early findings in the 2025 DSA roundtable. And the reflection we get helped us in our analysis. We are now in the stage of finalizing the analysis, and hopefully we will launch the study soon. So if we ask ourselves why this matters and why we need to focus on frontline workers, especially women, because they are the human infrastructure that keeps cash assistance flowing in Yemen's protracted emergency. They conduct awareness sessions, verify beneficiaries, manage referrals, and enable community participation, often in neighborhoods where male staff cannot work with women due to the norms and the culture of the society in Yemen. Yet, those same women face low pay, insecure six-month contracts, exclusion from decision-making, and a double work day of unpaid care. As one health educator in Aden told us, I love my work, it defines me. And that pride deserves to be matched by fair pay and real career. Next slide, please. Who are the frontlines workers? In our interview, we met with community health educators in the Cash for Nutrition program, facilitation officers for the unconditional cash transfer program, case workers working with NGO. All are embedded in cash transfer operation. These roles are overwhelmingly female, while the next rung-up program officer paid about $1,200 a month is dominated by men. But plainly, frontline women handle the most labor-intensive tasks for roughly 100 up to 120 a month, often paid late. And they serve as contractors between households, community committees, government institutions, all while managing family duties at home. And like my colleague Vincent, he mentioned that those frontline workers, although they are doing this kind of social protection and help the community, they themselves need aid. They themselves need this kind of psychosocial support. And when I met with some of those frontline workers, I was really inspired by their commitment and the strengths they have in themselves, in their work they are doing, despite all the challenges, especially in areas like Yemen, in rural areas whereby it's really conservative, really challenges, not only the type of work itself, but also challenging in terms of not being acceptable in a community to be a female and work in humanitarian program. And they face a lot of challenges from the community, from the families, and they continue, and they have this kind of commitment. And one of the ladies shared with me that every time she had all these kind of challenges, she go back home, but then she start to think about how much support she can help with to the family of her neighborhood or her community, so that they can have kind of dignity and kind of support to continue life despite all the challenges in Yemen. On the other hand, she also believed her work is really important for herself and her kids. And she was really proud to share with me that she started to send her kids to school. And that was really kind of a support for her family as well. But on the other side, some of those also frontline workers, they have been dropped into kind of depression, because each time they have this kind of 6 months contracts, and then they pause from work and they have to again look for a new job. And between that, they have no money to feed themselves or their families. And then they have to live on debt and have this kind of lending from others to continue their life. And she told me how she put a lot of pressure on herself to continue providing support to their community and her family as well. And despite all this kind of depression and challenging, now she started even to pursue her master study. And this story was one of the things that I will not forget in my life, because she gave me this kind of inspiration, how those frontline are really strong despite every challenge they are facing day by day. Skills and contributions. Managers and community, they prized women's capacity to build trust, navigate social norms, and mediate conflict. Skills essential for inclusive assistance. But let's not talk about these soft skills in a way that keeps women stuck in low-level, low-paid jobs. These interpersonal strengths complement with solid technical work, verification, data entry, case management. And if we value the contribution, we must value the worker. That means pathways to senior positions, not just a prize. Next slide, please. Barriers and gaps. So, payments. 100 and 120 per month, sometimes delayed for weeks. On the other side, 1,200 for the largely male officer tier. Contracts, as I mentioned, short, rolling 6 months delays, no security, no promotion letter. Leadership gap, senior posts remain male-dominated, stereotypes persist about men's and women's work. Costly safety requirements, transport, mahram. Mahram is the male guardians to be with the women in countries like Yemen. So if any female social worker needs to move from area to area outside her community or her governorate, she has to have a guardian with her, mahram, and she has to pay from her own pocket. And that because of the culture and the norms in countries like Yemen. And often they pay that out of their pocket. There is exceptions. One of the national social protection organization start to give them some allowance to cover the mahram cost. Training, opportunities for training in leadership, digital tools, and psychosocial support are limited. Together, these factors produce a gendered bottleneck that the system cannot afford. Next slide, please. So, what meaningful investment look like? Let's pay women in frontline roles more on secure contracts, promote, create clear leaders, mentoring, leadership coaching, protect, fund safe transport and mahram allowance, prepare, provide continuous training in data, leadership, mental health, social support. And it's really important also to have this kind of build mechanisms for frontline voices to shape programs design. It's about nothing about us without us, especially they are the one who link to their communities and know the culture, the context, the dynamics on their local communities. Next slide, please. That was the final one. So I will wrap up. So these steps are not luxury adds-on. They are operational necessities if we want social assistance to reach the most vulnerable efficiently and ethically. To close, I return to the frontline workers' word. I love my work. It defines me. Our task is to ensure the work does not also deplete her. And we are really looking forward to hear from your reflection, and that will really help us to understand more about other contexts. Thank you. Thank you, Paul. Over to you.
Thanks, Sabir. That was really inspiring. And just to flag that the research that Abir is talking about, we're busy writing a paper about, or more accurately, Becky and Abir are busy writing a paper about, and we hope to have it out in the autumn, hopefully in time for the Ideas Conference in September. So look out for it. And in the meantime, you can read the previous work that we did on capacities for social assistance in Yemen. I'm hoping, Becky, that you're about to helpfully share Rachel's slides that I'm going to talk to. But whilst you're doing that, so this should be Rachel Slater coming in now. She's a consultant and researcher with Basic Research, and she's been working with Proximity International, which is a consultancy organization with a particular body of expertise and fantastic work it's been conducting in Middle East and North Africa. And Rachel and Proximity, led by Alexandrine Duprat, so I'm mangling that, have been doing work in Syria and Iraq, looking at how sort of existing social protection systems have been maintained and sustained through the last decades of conflict. And one of the questions that they've been looking at there are what's happened to the workforce, what we're talking about today, what's happened to the local capacities to deliver social protection in Syria and Iraq. Next slide. In doing that, they've been drawing on the capacity cube, which is a sort of theoretical framework that Rach developed during the basic research inception period to look at to provide a slightly more complex look at how you think about capacity building for social protection in crises. And this brings in the different levels of capacity, which is fairly familiar: individual, organizational, institutional, so individual capacities to do jobs, but also organizational systems and the wider institutions around organizations. But also looks at the sort of different levels of capacities and then processes over time. And capacities meaning distinguishing between competency, capability, and performance. So not just the basic skills a person has and whether or not they can do their job if in a perfect world, but whether or not they can do their job in the real world in which they're trying to live, where all sorts of challenges, particularly in crises and conflicts, are happening. And so how you cope with insecurity disrupting your journey to work, or intermittent electricity, or all the other things that you might face in trying to do your job, or not being paid, as we've been hearing from Avir and Vincent. So next slide. So both in Syria and Iraq, but this slide talks to Syria, what we see over the period of conflict is an understandable decline in the public sector workforce. In Syria and Iraq, the public sector was very important as an employer, and that's been really challenging to maintain through the period of conflict. So a lot of public sector workforce have left. The example in the fourth bullet here is workers on the I'm going to forget the acronym, so this is why I should have Rach rather than me, on one of the main World Bank funded social assistance programs. It's lost most of its staff, and faced with this mass attrition, the regime tried to sort of stop people from leaving, but clearly that just in some sense starts to exacerbate the problem if you're trying to sort of force people to remain in their jobs. Next slide. So in looking at whether or not people could do their jobs and the competencies, capabilities, performance, we see lots of echoes of what we've just been hearing from Abir. We see a real effort by sort of dedicated professionals to continue doing their jobs, even when it's incredibly challenging, even when they're not being paid, even when they don't really have the support and equipment to do their jobs. So I think it's really important to recognize that whilst it's sort of often undersupported, as we've been hearing Vincent and Abir, the proper sort of the professional dedication that you see and that is a huge potential resource. Similarly to Abir, we see and Yemen, we see people being very poorly paid, people having to take on other jobs, having sort of double burdens, and people being very undersupported in very sort of fundamental ways. These are contexts characterized by violence and insecurity and the basic sort of safety and risk management systems to enable staff to do their job safely, the things that ought to be sort of minimum standards to protect people, often not in place. Next slide. So moving to the so what's, as we were hearing from Vincent, partly there's just a massive lack of understanding about the basics of what happens to the social protection workforce, and a basic lack of sort of workforce planning, a basic lack of just sort of the core data. The thing I tend to say in relation to this is no one seriously suggests sort of trying to maintain a health system through periods of crisis without paying attention to whether or not you have doctors and nurses to run clinics and hospitals. But we seem to expect systems to deliver assistance to people to function without giving enough consideration to the workforce that are doing that. In thinking about capacities, we need to move from just technical competencies to tackle capabilities and performance deficits, what people need to be in place to be able to do their job in the real world and to do it safely. We need to pay people properly, and that's difficult when you're in situations in conflicts where donor governments find it difficult to directly support civil service salaries or directly support governments. But to go back to the health analogy, for a long time, international aid has found ways to get around the fact that it's difficult to directly pay doctors and nurses and ways to invest in salary supplements. We need, I think, to pay equal attention to that in the social protection sector. And that's kind of the point of the final bubble, is that this is the problem where there's probably an enormous amount that the social protection sector can learn from other service delivery sectors. On that note, I'll finish with apologies for, much less rich analysis of Syria and Iraq than you would have got from Rach, who's actually been doing the work, but I've done my best. And on that note, I will hand over to Sarah. Sarah, over to you.
Thank you, Paul. I'm going to share my screen. Can you confirm that you can see my presentation?
We can. You just need to go to a slideshow view rather than...
Yeah. There we go. Okay, so my presentation is called Reclaiming the Human Face of Social Protection, and I'm going to try to examine how the role of the social service workforce, so social workers, can be strengthened in social protection, and it wraps up many of the ideas that the previous speakers have put forward. If you look at the history of social protection and social assistance in crisis, we've shifted from in-kind to cash-based responses at the same time as large social assistance programs were being developed around the world in lower and middle income countries. And many of these initiatives actually came out of ministries that were already under-resourced and under-considered, these social welfare, women, and family ministries. And these ministries were actually the ones that were connected to social care and were responsible, maybe with a paternalistic mindset, but responsible for the marginalized versus the other ministries, health and education, responsible for basic services. And little by little, we also saw that through social protection, we had a lever to respond to crisis, and efforts were made to set up legal and operational capacity to scale up during crisis. And this is what happened to a large extent during COVID. And then finally, technology was the driving force to cover more people at a lesser cost. And as these trends were unfolding, some really critical questions came to the forefront. First of all, are we addressing consumption needs, or is social protection and social assistance in crisis a way to overcome structural barriers to vulnerability and poverty? Are we addressing poverty? Are we addressing vulnerability? Are we addressing risk? What is social protection trying to do? Are we focusing on income replacement, or is it a categorical approach that we favor? is social protection the same thing as cash? Can social protection foster peace building? And all this was sort of wrapped up in this push to have social protection as a transformative system and to build social protection systems that are inclusive. And the terminologies and the approaches of cash plus and the push to design with intent to integrate, all this is really what we talk about when we say that social protection is a system beyond cash schemes with 4 independent pillars: assistance, care, labor market programs, and social security, and to connect this system to other services. But actually, in building this social protection infrastructure and these very large cash programs, the essential care infrastructure, so these social welfare ministries and their supporting workforce that was there before we introduced cash, slowly became sidelined. But to achieve what we set out to achieve and to achieve this transformative role of social protection, really only the social service workforce, so the workers of social protection, have the ability to interpret needs, to navigate local contexts, and to coordinate across sectors. I think the previous speakers really spoke very nicely to that in the research that they're reporting. And it's this relational role that really can help us achieve the results that we set forth. I'm just going to show another way of looking at the social protection workforce layers and to link this notion of social workers versus social protection workers. And Vincent already explained the different levels. This is a summarized view. So for social protection, you have the strategic leadership layer, the middle management layer that's in charge of supervision and program oversight. At these 2 levels, you often have social workers. Paul, sorry, I saw your hand up, but I was...
No, sorry, that was me being confident with Zoom. Apologies and
okay,
apologies for interrupting Sarah.
No worries. And so strategic level, middle level, and then the client-facing social service workers. So I prefer this terminology. I think it's less martial than frontline workers. And as the other speakers explained, they perform a whole range of services purely for social protection, registration, case management, even light touch, and also referral when you're thinking of cash plus programs. But in fact, because they mobilize a whole range of workers, as Abir and Vincent rightly pointed out, they do so much more because of who they are in the community. And they're also not all professional social workers, because that profession may not exist in the countries where we work, or because there are too few of them, and also because we're not talking about the statutory role of social workers. We're not talking about social workers who have a right to take a child out of their family because they're suffering from child protection risks. We're really talking about all these community level workers, and these are coined as parasocial workers, and when they're volunteered, they're coined allied social workers. This is from the Global Social Service Workforce Alliance that has done extensive work on this issue. And all these workers, they are the ones performing this relational service. So beyond the cash, this connection between the people receiving the assistance and the institution delivering that assistance. And I'm trying to really summarize the issues that have been brought about so far. I think one of the problems is that social protection has been really developed with an approach that has siloed cash from social assistance from social care, and has failed to see the potential of relational care in addressing transformation. So not just cash can address transformation, but it's really through this relation between the institution and the people that the institution helps. Abir really explained this nicely. The social service workforce is overloaded by administration and technology, and this is a stolen opportunity for doing more of the social work, which in many cases was the initial profession of the people we mobilize in social assistance. I think there's also a policy disconnect from the community level, and this is maybe a failure of localization, but in many of these programs that develop systems, it feels like a lot of the attention is at national level, maybe local authorities, but not at the level of the delivery, really, and all the different networks that are at play and how they are also mobilized during a humanitarian crisis. And as Vincent showed, when a social assistance program is put in place, these workers become over-specialized to serve the needs of this particular program, yet they are jack of all trades because they're also the disability extension worker, the child protection community worker, et cetera, et cetera. And so cash assistance becomes this invisible mobilizer of this workforce, expanding their role, but forgetting this dimension of relational care. In emergencies, these workers are ever so mobilized, and often it's women who play this role, and that's overlooked. They're, as Abir said, they're not even paid or recognized for their work. A lot of the literature on social work actually points to the fact that they are under-considered and under-resourced, but also that their role is basically unknown to many development and humanitarian workers. We just call them community workers, but we don't properly know what their function is. And Abir explained the strain that is put on these workers because of the nature of the work they do, the excessive caseload that they have to manage with limited supervision and support. What could be the levers to revive social work in social protection? A lot of the literature on care, the care sector and the care economy really helps us actually look at this in a more holistic way, looking at the different components of social protection. So of course, an obvious one is to integrate better cash and care, not call it cash plus, but actually make it a program where social assistance and social care are delivered together. Vincent talked about workforce planning. Yes, workforce strategies need to be put in place that include capacity development along the side of the capacity cube that Paul explained, but more broadly, workforce strategies need to be part of policy making. Stable financing is very important for the workforce. Many of these programs look at the systems and forget the cost of delivery, the human cost of delivery. As I said, many of these issues are explored in the literature on gender and on the care economy, also on disability. And it would be very interesting to integrate the notions that are explored there into the social protection research and literature. We need more data and evidence on the workforce. It's hardly there. Apart from the website of the GSSWA and the International Federation of Social Workers, there's very little that's been written. Most of it comes from child protection and the HIV crisis, but this needs to be refreshed. And finally, the legislation needs to be in line. Only a few countries, and a lot of them are in the old Soviet bloc, have a legislation for social work and a scope for professionalization of this workforce. If we could activate these levers, we may have a better articulation of the 4 pillars of social protection and how social workers and these pillars across these pillars work together to help manage both vulnerability and risk, and that would maybe help us put dignity into cash delivery. That's the end of my presentation. Thank you for listening.
Great, thank you, Sarah. Do come back on, Vincent, Becky, Abir, and we now have time for some discussion. So do other participants either put stuff in the chat or the Q&A, or raise your hands, and Becky can give you the floor, and we can kick off some discussion. Becky popped a question in the chat about the the current aid context, the challenges of doing less with less, the fact that organizations like Vincent's are busy laying off lots of their own staff, and so how can we be making the case for this case for investment? Any reflections on that, either yourself, Becky, as you've grappled with this conundrum, or Vincent or Sarah, on how we make the case for this in the current aid environment?
Yeah, it's difficult to, it's a very difficult question that's way beyond, I think, our respective functions. But I mean, I'd like to connect it to localization and the fact that if the next phase of aid work is really truthful to the localization agenda, then there should be more investment in the resources that are delivering for these systems. I would say that's, and maybe to tie it to Jeremy's question, the mutual aid is a systematic phenomenon, I would say, in every crisis. But mutual aid is not an end in itself. It happens. It's endogenous to the crisis, but it's still people working, and it's people who maybe the first week can do it on a volunteer basis, but if they are to continue and that they demonstrate that they have that skill, you can't rely on mutual aid only as part of localization to respond to these crises.
Yeah. I also, I mean, partly, even in the context of aid cuts, in lots of crises, assistance is still being delivered to very large numbers of people. And so we've set in place these complicated systems for getting cash to people, but we're failing to pay the people who deliver that cash to people. And that just seems weird. Part of making the case seems to me, if you're already giving people money because they're poor and vulnerable, surely you can give people money to do the work that is needed to pay those people to be poor and vulnerable. So maybe you need to slightly adjust down the caseload of people being supported and adjust up the caseload of people being paid to provide that support. Yeah, at the margins. Becky, you've got your hand up, and then Vincent, if you have anything on this.
Yeah, I just wanted to share a brief reflection, not necessarily answering my own questions. I think it is a really tricky one of how we cut through the noise. But I do hope that the research that Abir has been doing in Yemen really will bring out stories, examples of how these local workers are essential to the delivery of programs that are, supposed to be inclusive. That's the objective, right? That they respond to people like, especially women and girls in the context of the protracted crisis in Yemen, who are vulnerable and affected. And the stories that Abir managed to draw out from some of the frontline workers was all about how it was down to them to know who in the community was struggling to understand what transfer they were eligible for, perhaps struggling didn't know that there was a hotline, for example. These are workers that they're not nice to have. They are the ones who are delivering the program. And I think the more we can counter this tendency that there's been to not spend time on listening to them, on understanding their workloads and the skills that they have, the better. And I hope that will go some way to answering this challenge of cutting through the noise of there just not being enough money, but saying this is actually not a nice to have in that context. It's an essential. Yeah.
Vincent, Abir, do come in on this question if you'd like to, or the question from Jeremy, which I'll just paraphrase because I missed it in the chat. So for other people who might have missed it in the chat, Jeremy said, "Thank you for the presentation. what would collaboration rather than reliance look like when formal interventions seek to work through individuals into the traditional support realm? And he gives the example of Ethiopia, where customary officials have been involved in PSNP implementation in pastoral regions for many years. The program relies on them, but it seems to be a mutually beneficial collaboration in many settings, as these customary officials derive access to resources. It would seem that in most places there isn't a binary between reliance and collaboration, but much negotiation around how these individuals get involved. So Jeremy, do get Becky to give you access to talk if I've mangled what you were asking, and Vincent, if you want to respond to that. But while you're thinking of how to, Sarah's also got a hand up. So Vincent or Sarah, one of you come in.
Yeah, Jeremy, are you able to just ask? Otherwise, I can speak to it.
Go for it now, Vincent.
Okay, sure. I mean, this is an area which I think over the past few months I've been increasingly trying to figure out, right? So when we started to look at the frontline workforce and social protection, we very much took this sort of institutional system building role, right? We're working with ILO, UNICEF, etc. But as we did that work, we realized that so much of social protection is so reliant on the roles, the relations that exist at local levels, that there is effectively marriage and negotiation taking place anyway, right? That in many of these countries, and this includes in sort of much more developed social protection systems, even South Africa, you'll have the whole system of administrators for SASA, but they will be relying, in the case of Africa, on a network of government supported NGOs. But then ultimately, there are community leaders that will be helping to identify people, that will be facilitating access, right? So even in relatively advanced or very advanced countries, this interaction takes place. So how to collaborate rather than sort of rely on or sort of just ride on. Ethiopia is kind of a unique case because it's one of the few countries that has not been colonized in Africa, so it's retained a very Ethiopian governance structure, right? So the whole idea of woredas and kebeles and how they interlink with the overall administration and governance of society has been embedded into the philosophy of the social protection system, right? So if you look at the institutional markers of social protection, governance, financing, legislation, in Ethiopia, there's almost a more organic approach taking place anyway. So it's not unusual, or you'd actually expect that there'd be some sort of mutual benefit arrangement when it comes to working within these structures to then allocate resources. But if you use similar structures in other countries, you might find that sort of natural governance connection doesn't exist. Now, how can you work with them? What some of you I've been talking to. We've been working in a bit of an informal group on trying to identify ways in which informal and formal social protection systems can better speak to each other. I wanted to post a link to some of these papers in the chat, some short papers. Oh, Becky just posted it. But basically there in the third short paper, a short essay I wrote on this, I put a bit of a matrix, and I laid the sort of the traditional pillars of social protection, so insurance, assistance, and sort of labor market interventions, and layered them also against informal schemes that exist across many African countries, right? And whether that's interpersonal mutual aid networks or more structured systems like zakat, or church-based outreach, or even rotating saving systems, village savings and loans associations. A lot of these structures, you do find similar versions of it in many different countries, not just in Africa, but beyond as well. And often there are ways in which you could better link with the work they're doing, the infrastructure, the technologies they're using, the people they're using, in a way that supports what the original intention of those mutual support networks were, and then at the same time also extends the potential reach. In the time of funding cuts, of international aid funding cuts, it is important to recognize that a lot of mutual support is in fact providing the lifeline or the safety net for the vast majority of people in developing countries. So even saying something like, okay, social protection is very low coverage in country A or B, but mutual support systems often have, massive coverage, even if they might not be adequate or appropriate for all situations. So I think finding that is where we, where we need
Right.
to invest our focus.
Thanks, Vincent. So you've had your hand up, so come in, and then we've got a new question from Sarah Murray that I'll summarize and maybe ask you, Abir, if you have any thoughts about. But Sarah, you first.
Thanks, Paul. Yeah, I wanted to say that the way these social assistance programs are designed, they actually miss on the opportunity to do relational work because they put so much emphasis on post-disaster monitoring, for example, grievance redress mechanisms, collecting data on MEB. I mean, all these processes mobilize human resources, but somehow they miss out on the fact that when these people go and interrogate beneficiaries, they could actually do this more relational social type work. I mean, I work in Iraq, and the social workers in federal Iraq are not allowed to do social work. They're only allowed to collect data for the PMT. And when you ask them, do these people have other problems other than cash issues? The social workers say, well, 100% of the people we see have more than a cash problem. So this is what maybe where also in the design we should put less emphasis on these sort of standardized ways of delivering cash and reintroduce this relational dimension. And I don't know if that's also partly answers Sarah's question.
It very much answers. I think it's a brilliant answer to Sarah's question. But a bit, yeah. I mean, Sarah's question is about is the shift to more sort of digital means of delivery and digital approaches delivering assistance, marginalizing the role of frontline workers, and if so, what you can do about it. Abir, over to you.
Yeah, I think again, social protection is about human. Yes, digital could be finance. Digital could be like solution for better kind of a payment process. But by the end of the day, you need human to do all the type of work, to do the relationship, to do the interaction, to do the verification, to understand the context, to sit with the communities, especially in countries that this facing a lot of kind of, let's say, problems and crises. Digitalization is not the ultimate solution for them. It's beyond that. We don't have the basics of the technology. And for now, for instance, WFP now in Yemen, they are doing a pilot in how to do this kind of digital financing in very small areas to test. Because in Yemen, for instance, 80% of women are illiterate. And many people in rural area, remote area, even they don't have the smartphone. So there are a lot of challenges to talk about this issue in countries that having a lot of issues, conflict, and other challenges. And by the end of the day, even if there is a digitalization of such social assistant, by the end of the day, it's about human beings. You need to talk with them. You need to understand. It's about the feelings. We are dealing with people, not machines only. So yeah.
No, indeed. And the thing you're both talking about, and so you're talking about the sort of shift from social workers who are empowered to do things to sort of enumerators who are empowered to fill out forms is definitely a trend you see beyond Iraq. And even though there's human interaction going on, whether it's over the phone or in person, if that person is only able to ask questions on a tablet and fill in the boxes on that tablet, then they're completely disempowered, and I think we need to look at those processes. And in doing that, I always think that it'd be great to think harder about how we link humanitarian protection approaches with social protection. We've tended to focus in humanitarian and social protection linkages, we're linking cash delivery, humanitarian cash delivery, and social protection. But there's a whole field of humanitarian action which is about protection, which is fundamentally about some of the care and case management things that Sarah's talking about in the social protection sector. But there's been a real under-analysis of linkages between those approaches in crisis settings. So I hope that answered part of your question. I don't know how you shout, but do shout in the chat if you want to come in person or ask a follow-up question. I don't think we've got any more questions in the chat. So what we might do is final reflections and give everyone time to make a cup of tea and finish a bit early, unless people come in with more questions. So Sarah, you've got your hand up. So over to you, and then I'll do a round robin of people, and then we'll wrap up.
Yeah, Paul, actually, because Jeremy had a question that we didn't really answer, which was about, if I understood well, are care workers mobilized in other types of state services? So in terms of social workers, professional social workers, yes, in many countries, they work for the Ministry of Interior, Ministry of Justice. You find them in Ministry of Education, Ministry of Health in some countries. So they're present across, there will be one or two in these services at decentralized level. But I think what's maybe more relevant is that when a program starts, like I'll take the example of Madagascar, maybe it's the same in Ethiopia, but when this large World Bank safety net program was rolled out and they decided to do a bit more social care, the workers that they mobilized to do this work were actually the health workers, the community extension workers, the traditional birth attendants, and the disability community extension workers. So it's more that they themselves are already the bridge to other services, and they are so skilled at community level in their community level work that it's a real blind spot, I think, in social protection programming. And just to say, in active labor market programs, if you look at historically what they were at community level and the graduation pathways, graduation pathways, it's really social workers that you use to coach people into accessing better livelihoods opportunities. So within social protection, you already have that linkage established, social assistance to social care and to ALMP. So I'm not wrapping up at all, Paul, but to wrap up, I will just say, I think you've heard me over the years talk about this topic. I want to say I'm really glad that BASIC is picking this up, and I know UNICEF is paying more and more attention to this. We need all your energies as researchers, as practitioners, to put this voice more at the forefront. We've all worked with these community level workers. We've seen their plight, I think, and especially the plight of women who do this work. And so we need all your forces to bring this at the center of the debate on the humanitarian reset as well. Thank you.
Thanks, Sarah. Yeah, well noted in terms of the plea for action. Yeah, we will also be emphasizing the point to the currently ongoing high-level panel on social protection in conflicts, and hopefully you and others put that in their recent call for evidence, and if not, we'll badger them to make sure it is on the agenda for that. Which order should we go? Vincent, you next, then Becky, then Abir to wrap up.
Yeah. The only thing I'll say is it's so important, right? When we started looking into this and we found others that cared about it, it was just mind-boggling that there was not more attention paid to, the role of frontline workers, and many countries, and not even talking about fragile humanitarian, sort of protracted humanitarian crises, just the countries that are doing quite well in terms of their own development are really having this immense challenge of how will we sustain a social protection system that is intersectoral, that links with health, with education, with health insurance, with social work, with productive inclusion, right? And that is reliant on having some sort of community interface to make sure that the solutions that the state and the partners offer are actually appropriate. And there's very little systematic reflection on who's actually going to do it, and very much an expectation that, you know, whatever happens at sort of the community level, it's good enough. A lot of the decisions are taken at capital level or even sort of at the donor policy level. So really, it's a play in the countries that we all work in to start having those discussions, right? To start saying, you know, what exactly is the frontline workforce in the country I'm currently working on? Who's talking about it? Who's actually, trying to map it? Or should we try and map it? Should we identify how it's being financed? You'll find that when you look at social protection budgets, often a lot of the budgets in the ministries of finance are primarily for transfers or some vaguely defined overhead, right? But then the actual staff of social workers, of education workers, etc., they come from either sectoral budgets or decentralized budgets, right? So the municipal budgets, and they're invisible. So if you're talking about adjusting for inflation, but you're not talking about also making sure that those workers that you need to deliver the benefits are getting the needs, then you're basically hiding a huge part of the cost of doing social protection well. And it's an unpopular message because it basically means you have to spend a lot more money, but you do get a lot more for it in the end. You don't want your systems to collapse, right? So it's really a good social protection program or dialogue in any country needs to know who the workers are, understand what the networks and relationships are. It's okay if a large part of that's informal, but try not to harm, you know, the informality that there exists that is actually helping the country to move forward and to do mutual aid as well. So that would be my plea and takeaway, and I'm happy to have any discussion with anyone that joined this call and sort of think through what that concretely might look like in specific cases. Thank you
Thanks,
for everyone
Vincent.
for listening to us.
Becky and then Abir. So over to you, Becky.
I'll only say a couple of points very briefly. The first is that I think the others have already stressed how important this is, and I was really blown away by our research in Yemen about the work that these frontline workers are doing, and the capacities that are there from people who have worked in the social protection field for decades. And obviously that's capacity that requires support. I think, as well as thinking about things like pay and contracts, in terms of practical support as well, it's great to see in the Yemen context really practical support like covering Maharam costs, as Abir said. Things like that make all the difference on a day-to-day level to allow these workers to carry out their roles successfully. So I think in each context there's going to be steps that can be taken at a really practical level to improve their working conditions and enable them to improve the effectiveness of the social assistance programs. And I am very pleased that our report will be published soon. And obviously we'll keep in touch with you and let you know when it's out, and look forward to more discussion around the findings. Thanks.
Thanks, Becky. Abir.
Thank you. So I can wrap up saying that without them, we couldn't have been succeed in delivering humanitarian and development assistance to the most in need in terms of countries that facing crises. They are the one who are there. They are the one who can navigate all the challenges, who can also sit with the communities, understand, verify, do all the work. They are human themselves. And if we are talking about, and we care about protection, social protection, we need also to take care of them. As Becky said, one of the findings that we had during our work in Yemen, we found out a massive kind of experience with many of the front lines for around 20 years or more than that. On the other side, no one is thinking about them, no one involving them. They are rushing to do this kind of work using volunteers, deliver and go, but no beyond that. And one of the things we find out in different evaluation that people weren't at the center of the work done. And to do that, you need to invest more in the frontline workers, give them all the needs, that they can have the dignity, they have trust, confidence in themselves, and they can overcome the challenges they are facing to, by the end of the day, do a proper job for their communities. Thank you all.
Thanks, Sabia. And on that note, we will wrap up. Alan from IDS has just put a note in the chat. I'm sure none of you are thrilled at the idea of doing a quick survey, but I'm about to give you 10 minutes of your life back because we're going to finish early. And we do get brownie points for FCDO if we collect metrics on these sort of meetings. And so in the interests of earning me and my colleagues some brownie points, please do spend a couple of minutes filling in the survey. To wrap up, like all of the panelists, I find this a really exciting and important agenda. And one that I think is, as Becky was saying, some of it is straightforwardly practical and doable. So, often in this, particularly in these very difficult settings, it's hard to come up with concrete policy recommendations. It's all complicated. You need more research, and all of that is certainly true about this. But actually, in the context of which we know about in Yemen and that we've been hearing about, if you could raise the pay of the people Abir was talking about from $120 to $180 a month, and you could promote a cohort of women to the officer level that pays them $1,000 a month, you'd have made a real difference. And that, I think, should be doable by SFD within its existing budget, supported by UNICEF and the World Bank. And that's not a hard thing to do. You could do that tomorrow. And so I think in looking at particular places, we need to find these simple, practical things we can do to support the social protection workforce better, and we can take forward that agenda in real concrete ways. So thank you everyone for listening. We'll record it, so lots of people who signed up and didn't make it today, we can nag them to listen to it. And thank you everyone for your time today. Bye everyone.
Thanks, everyone.
everyone.
Bye. Thank you.